pleasure that I welcome all of you to this session. It's a privilege to introduce our esteemed speaker today's program, Dr. Chander Prakash Sharma, the Principal Professor, Head of the Department of Homeopathic Pharmacy and Medical Superintendent at Bakson Homeopathic Medical College and Hospital, Greater Noida. Dr. Chander Prakash Sharma, as distinguished homeopathic expert with over 21 years of professional Prakash Sharma, as distinguished homeopathic expert with over 21 years of professional experience. He holds PhMS from Vikram University and MD from JRN Rajasthan Vidyapeeth. Dr. Sharma taught for 18 years and served as administrative role for 18 years. He served as approved examiner, paper setter and evaluator by various universities and was also faculty member at Homeopathic University and published numerous research papers in reputable journals. Now I request Dr. Anusha Ji, Assistant Professor and Lecturer, Father Bana Homeopathic Medical College, Department of Homeopathic Pharmacy, to welcome Dr. Sharma by giving speech. We are truly fortunate to have Dr. Prakash Sharma with us today, and we look forward to benefiting from his wealth of knowledge and expertise. Please join me in welcoming Dr. Chander Prakash Sharma to this session. Thank you, sir.
This post-lunch session, the session which is held immediately after the lunch, is seriously interesting. But I will make sure that it will remain interesting. So, all the faculty, all the participants who have come here are present here in the classroom, or we are waiting for somebody is admitted. All have come. Okay. So am I audible to you? Clearly? Okay. So we are starting. So this is the first slide of the presentation, and here we can see that. So let me start with some another way. I hope all of you have seen the curriculum draft of Homeopathic Pharmacy, especially the curriculum draft which is shared by NCH and uploaded by the NCH on its website. You must have gone through it. So this first slide is showing just on one page all the aspects, all the parts, different components of the curriculum at one place, at one page. Here you can see point number 1 to point number 8. So the entire curriculum draft of Homeopathic Pharmacy specialty for PG in Homeopathy has been described in the curriculum draft in these 8 parts. You can see point number 1 to point number 8. In point number 1, first of all, the title of the specialty course and its abbreviation. Then components of the curriculum. Next, brief description of specialty. These are only points I am reading for you. Please read them quickly. Then you will understand. As we progress to the next slide, you will understand. So, like this, there are 8 points. Remember, 8 points. Now we are coming to point number 1. This title of the specialty course. See on the left side of the slide. Sorry. Here. MD Homeopathy, Homeopathic Pharmacy, Home-PG-HP. So this is the code, official code, which has been given by the Homeopathy Education Board for our specialty. For university purposes, for examination purposes, for mark sheet purposes, this official code will be used. Home is homeopathy, PG and HP is homeopathy pharmacy. So this is point number 1, title of the specialty. Coming to next, point number 2, you can see components of the curriculum and brief description of specialty and then course objective EPS. Now, do you have a detailed draft of curriculum in your hand? Please open it. So that the purpose of this session is I want to make you familiar with the curriculum draft. You should be friendly with the curriculum draft. When you are familiar, when you understand the gravity of it, when you understand the meanings of the contents, then you will be able to further, transmit it to your students. So, you have opened point number 1, title of the specialty. Yes, this is the one in your hand. Okay. Now coming to point number 2, components of the curriculum. Anybody who does not have can take this copy. I have one extra copy. Anybody who does not have. So here in the curriculum draft, this is point number 1, title of the specialty. Then point number 2, components of the curriculum. Can you see? So are you with me? The point number 2 is components of the curriculum. Look in your curriculum draft. This is MD Home Part 1. There are 3 papers. So did you see in your curriculum draft? What is it saying? The components of the curriculum is saying that MD Home Part 1. MD Home, the course duration of the course is 3 years. Part 1, 1.5 years, and Part 2, 1.5 years. So during MD Home Part 1, there will be 3 papers. MD Home Part 1, Paper 1, Paper 2, and Paper 3. Paper 1, the name of the paper 1 is FHP, Fundamentals of Homeopathic Pharmacy. Please look in your curriculum draft and you will be able to understand more clearly. Fundamentals of Homeopathic Pharmacy, this is paper 1. Paper 2 is Fundamentals of Clinical Medicine in Homeopathic Pharmacy. I again repeat, Fundamentals of Clinical Medicine in Homeopathic Pharmacy. Here we have to correlate the clinical medicine part with our specialty. And paper 3 is research methodology and bioscience. Up to this, all are clear. Now coming to the next part, MD Home Part 2. In Part 2, we need to study our own specialty only. So in Part 2, there will be 2 papers. Paper 1, Paper 2. Both from our specialty only. Homeopathy Pharmacy Paper 1, Homeopathy Pharmacy Paper 2. If you are oriented till this level, then only you will be able to understand further. So I again repeat before going ahead. For MD Home Part 1, 3 papers. Paper 1, Fundamentals of Homeopathic Pharmacy. Paper 2, Fundamentals of Clinical Medicine in Homeopathic Pharmacy. Paper 3 is Research Methodology and Bioscience. For MD Home Part 2, there will be 2 question papers, Homeopathic Pharmacy Paper 1 and Paper 2. Now coming ahead. Now next part is brief description of scheme in your curriculum draft. Point number 3. Remember, I have shown you total 8 points of the curriculum. Now we have come to point number 3. The brief description of specialty and its relevance in homeopathy postgraduate course. You can read it, that is for just a brief introduction for your orientation. Now coming to point number 4. During the pre-lunch sessions, we have very well understood what are EPAs, entrustable professional activities. I assume that you now understand the meaning of it. But for your clarity, I can just repeat it brief. Entrustable professional activities means suppose your student, suppose one candidate who has taken admission for doing PG in homeopathic pharmacy. He has taken admission in your college, right? After completing this postgraduate course in homeopathic pharmacy, as a teacher, what do you expect in him? Like after becoming a PG degree holder, when he will be going in the market or in the society for practicing homeopathy or for teaching homeopathy, if he joins some institution or if he joins some pharmaceutical industry. So what qualities, what competencies you need to see in that particular candidate? That will be developing a trust for him in you. You will see that I have full trust on this candidate. I have full trust on this student that after PG he will be able to do these things. These are EPAs. So before the commencement of any work, we must establish some objectives. These are the entrustable professional activities which a PG degree holder must possess in himself or herself. What? Let us read in detail quickly. Number 1, I have made the text bold. Drug analyst. Rest of text you can read on your own. He should be able to become a good drug analyst in a pharmaceutical industry setup. Next, perform good manufacturing practices in homeopathic pharmaceutical industry. GNP you all know. Next, demonstrate qualities of good marketing skills, which is very important from pharmaceutical point of view. If someone is doing MD in homeopathic pharmacy specialty, this is also a part of his activity in his professional life. And if he does not have that competency in himself during PG course, we need to train him. We need to train her on this part so that these skills get developed in him. Next, perform duties of an academician. You see, I am not telling you anything new or anything which is not known to you. Whatever points are mentioned here, all are known to you. You know it and I know it too. There are no new points in this. Only the presentation is different. The naming, it has been named in a different way. Suppose any student who wants to pursue MD in homeopathic pharmacy, and if he takes consultation from you, sir, after doing PG in pharmacy, I should be able to do what? Then you will be telling him these points only. There is nothing new in it. But we have just structured it, designed it. We have just put it in a black and white format. Next is perform duties of an academician, because tomorrow he will become a teaching faculty in any medical college. That is another EPA. So that quality also needs to be explored in himself by his teachers. Next, report adverse drug areas, which you know by pharmacovigilance, adverse drug reactions. Perform administrative responsibilities in the hospital pharmacy. Administrative role. You know what are the roles of administration in maintaining a authenticated drug sources for primary assays in plants and chemicals. Authenticated drug sources. I am very fortunate to share with you that Dr. Raja Manikam sir, I am very thankful to you because when HCH Homeopathy Education Board constituted the panel of subject experts for homeopathy pharmacy specialty for designing this curriculum draft which is in your hand. The Homeopathy Education Board constituted the committee for homeopathy pharmacy and there were 3 members. Number 1, Dr. Raja Manikam sir. Number 2, Dr. Manisha ma'am. You will see in the curriculum draft the list of experts is there published in this curriculum. And myself. So, Dr. Manisha sir, me, we have worked together for many weeks, months and more than a year. Several meetings, several discussions, several WhatsApp calls. So I am grateful to his kind contribution because of which this curriculum draft which is in your hand today would not have been possible, I am telling you. So heads off to you sir. Thank you very much for your contribution and this is a boon for this teaching faculty which you have done. Now further going ahead. So all these authenticated drug sources, many of the points were suggested and narrated in details by Raja Manikam sir. Sharma sir, we have to include this, we have to include that, this is not required, please remove it. You remember sir? Next is functioning R&D branch. This is another important aspect. Very important EPA. Perform specific laboratory skills that are required for new drug development. That is the need of the time. Development of new drugs. This is the need of the time. And the PG degree holder of tomorrow, if he does not have these qualities in these EPAs, then literally, believe me, this PG degree will be only a paper degree. But all thanks to NCH and particularly Homeopathy Education Board under the able supervision and leadership of Dr. Tarkeshwar Jain sir, because of his continuous dedication, motivation and commitment, determination, this PG education is now taking a totally different direction. So laboratory skills, because there are many laboratory methods. Sorry. You see, there are 2 types of laboratory setup. One at the institutional level and one at the industry level. Institution level, that is your own college department laboratory, homeopathy pharmacy laboratory. And another one is the laboratory of a pharmaceutical industry. You see? So, both the setups are totally different. The infrastructure is totally different because in a college laboratory we have a little small setup, but in the industry we have a very large setup for manufacturing. For manufacturing different medicines, solutions, mother tincture, different sections. So both kinds of exposures are required for a postgraduate training. That is why I am going to highlight here. With this motive only, in the syllabus, we had lot of discussions with subject experts also. We have categorically, specifically kept 1 month internship for duration of 1 month for a PG training of homeopathic pharmacy specialty. For doing what? For proper industrial exposure with the pharmaceutical industry. Because you just imagine your PG specialty scholar, if he goes to a factory, he lives there, he remains there, he stays there for 1 month, every day 9 to 5. If you go to the industry, laboratory, all laboratories, whether it is related to QC, quality control, or quality analysis, or R&D, or preservation, store, marketing, packing, labeling, packaging, everything. Just imagine he will be able to achieve this BPA. With this purpose only we have kept this 1 month's internship. And what will be the outcome of this? Can you imagine? The purpose behind sending them to industry for 1 month internship. What would be the objective of this? What would be the benefit of this? After possessing PG degree, what would be the benefit of this internship training? Number one, he will be aware of the quality manufacturing of homeopathic drugs. The medicine which he is prescribing at his clinic for his own patient, how it is prepared, how it will work, how it is to be dispensed. He will be having the practical idea of everything, because so far in BHMS course he has read only few books. He has practically not seen anything. And even if he has seen something at a very classical level. And secondly, most importantly, from professional future prospects also. Let me explain. You have seen pharmaceutical industries, homeopathy, in the field of homeopathy, like Bakson, SBL, Schwabe, Redware. There are many others also. So in the pharmaceutical industry, very straightforward question. You know, I am not a teacher, you are not my students. We all are colleagues. You are a part of the teaching fraternity. We all are teaching faculty. We belong to the same faculty. Our designation is only one, teaching faculties. So I am not teaching you anything. We are just sharing our knowledge with you, and you also will share. So you have seen the pharmaceutical industry. You have seen their QC, QA, R&D lab. You have seen what type of professionals the institutions and the industries are hiring for these sections. Have you ever seen? Chemist, botanist, zoologist, hiring or not? So being a homeopathic manufacturer, we are offering job to a person who does not know anything about homeopathy. And by doing this, we are going to create a product in the market who is having all the knowledge. See point number 8. How to collect authenticated drug substances. How to collect authenticated drug substances. Identification, collection, preparation, even up to the level of marketing, I said. So all these MBAs, when a PG degree holder will earn and learn himself on himself, then in the future what will happen? Who will be getting job in that pharmaceutical industry? Who will be getting job? A homeopath. Yes or no? Please discuss with me, debate with me if you don't agree. Yes or no? Yes or no? One who has read BHMS 5.5 years, he has devoted his 5.5 years for homeopathy, then 3 years for post-graduation. He or she will be able to work authoritatively in a pharmaceutical industry. So that is the purpose. Why I am highlighting this? So that you can, I will give you the chance to speak. So that you can, inculcate these things to your students. You can tell him that be confident. That is the benefit of reading this. This is a two-way communication, not one-way. Yes, sir. the same ignition has ignited your mind also. Yes or no? So that is the sole purpose of this. Otherwise, this is a draft. You can download it from the website. You can read it on your own. Few pages today, few pages tomorrow. At least in a month, 1 month you will be able to read the entire thing. And then something will be applied and something will not. But that is where the purpose will be defeated. That is why we are here today. Now coming to next is industrial manufacturing processes. We have already talked about. Whatever we have seen through eyes in the book, now we have to see with through eyes, not in the book, but in the devices, in the laboratory, whether it is the laboratory of institute or the laboratory of industry. Okay? But you know, pharmacy subject was taught in first BHMS to homeopathic graduate in a very concise form. Now there is a strong need to elaborate it further. If we do not elaborate, these EPS will not be possible. Next is medication stores. Statistics for medicine consumption. You know, this is also important. Medicine store. How to manage a store of medicines. How to maintain the inventory. How to measure the requirements and the consumption of medicine. What was bought, what was brought, how much spent, how much remaining, what is to be purchased now. So all these are the parts of medicine stores. Another point, for opening a retail or wholesale homeopathic drug store, our MD homeopathy pharmacy is competent and he is efficient to get the license in his name. Okay, next, very important point number 14 and 15. Please remember, point number 14 and 15, very important, but new. These are the new things. So I am highlighting. Number 1, agro-homeopathy, and number 2 is veterinary. Agro-homeopathy. Assessing the effect of homeopathic medicines on growth and production as well as various plant diseases. The effect of our homeopathic medicines to be assessed and observed in plants, in the diseased plants. So this is the new concept, new field, which is known as agro-homeopathy. The students will be posted in the farms, like where the potatoes are grown. Potatoes are grown, potato farm. And if we are injecting one medicine timely, we are applying to the soil, then the growth, development, and production of potatoes is increasing with the help of homeopathic medicine. That is agro-homeopathy. If the time permits to me, in my college, in Bakson Medical College, few PG scholars there have been working in agro-homeopathy. Their article is also published for this growth of the potato with homeopathic medicine. I will be sharing with you that article. After reading that article, you will understand the concept of agro-homeopathy very clearly. Next is veterinary homeopathy. By conducting a thorough research on animals, we can see the effects of homeopathic drugs on animals. This is a new concept. You must have seen a few of the pharmaceutical companies are manufacturing veterinary products, homeopathic products. You have seen, you have heard or not? You have seen homeopathic medicines for veterinary purposes, for animals, particularly for dogs, pets, cats, cows, Milking of cow. The quantity of milk is increasing. I apply homeopathic medicine. Lactaminum. What is this? This is application of homeopathy in veterinary science. So this is another interesting science of tomorrow. So at least during anti-colds, you will give a concept in his mind. Next is formulating drugs. Publish, yes. Publish. Very important EPA. During PG also and after doing PG also. During practice also. During job in an institution also. Every time we must publish what we are doing. If it is worthy of it. If you are doing something, let the entire world know about it. Let the entire homeopathic fraternity read about it. You don't know the importance of publication. If you write something, you have just written something and you have published it. But mind it, that publication is going in thousands and thousands hands. And that is being read by thousands and thousands of eyes and brains. So you are going to ignite several brains. So please encourage your students to publish more and more during PG also and after PG also. Self-directed learning by arranging and coordinating and attending CMEs, conferences and workshops. Teaching learning techniques. Because during a PG curriculum, a postgraduate student is required to take classes for UG students also. That is teaching learning process. Next. So these are, now I am coming to the draft again. We were in point number 4 now. EPS. Total 19 EPS are there. After EPS, the next point comes very important part, mapping of EPS and domain competencies. Mapping of EPS and domain competencies. So now please focus on what I am going to say. Otherwise you will not be able to understand what this table is doing for you. This is the table. The heading of the table is mapping of EPS and domain competencies. I am going in very brief. So please focus on my words. If you miss the words, you will miss the meaning. Mapping of EPS. EPS means those 19 points which we have discussed with domains of competencies. What are the domains of competencies? In the prelim session, Dr. Munir sir has already explained to all of us. What are the different domains of competencies? KS is very good. Next is EC patient care, homeopathic orientation, communication skills, problem-based learning, and professionals. So these are, don't get confused by the numerous terminologies and don't be afraid of anything. Try to make friendship with this curriculum draft. It is very easy, very comprehensive. We have to just make a friendship with this. If we don't make it a friend of ours, then we will see what is this, from where it has come, how will we understand it, how will we implement it, how our students will be taught by using this. You will see a great mountain in front of you. No, don't be afraid of it. Very simple. So here what we are going to do, mapping of EPS and domain competence. Total EPAs, serial number 1. Total EPAs are 90. First EPA is drug analyst. We have already seen in the curriculum graph. In this PPT, I have used only one table for one EPA. Just to make you understand that what this table is trying to show to you. So, this is the EPA. So, to attain this competency, to attain this EPA, this entrustable professional activity, what are the competencies which should be present in your student? You know what is competency? I can do this. This is my competency. Now, let me show different levels. Nose how, shows how. You know it? So, nose, that means your knowledge. You know it, you know something, that this is a remote. You know that this is a remote, this is your knowledge about it. But knows how. KH is knows how. How does it work? This is your competence. You know something, that is knows your knowledge. You know how, that is your competence. SH is shows how. You know it, how it is there, why it is there, you also know it, but you are able to show to others, to explain to others. That is show how. This is your performance. And does is your so you must have seen in UGCBDC this keywords, hierarchy, and letters, pyramid, and groups, taxonomy. So these are the different levels. Now coming to, so I was explaining here. So these are the competencies. These are the competencies in your students. To learn this EPA, you want that my students should be able to perform this activity. To learn this, what type of competency is required. So that particular competency and that particular EPA, their mapping is shown by this table. Am I clear? This is mapping of EPA with the competency. So to become a drug analyst, he should have tick mark. Knowledge and skill he should have or not? Yes. Then patient care. It is nothing to do with patient care, because here we are talking about drug analyst. So that in patient care there is no tick mark. Am I clear? Then in homeopathic orientation, yes, your student must have a homeopathic orientation. Then only he will become a true drug analyst. Then communication skills, not much required. Problem-based learning, yes, it is required. And professionalism, of course it is required. So now I hope you have understood what is this mapping of EPAs with domains of competencies. So like this in your curriculum graph you can see this table is there which is having how many points here in the serial number 2, serial number 19, and in respect to each EPA, what are the competing agencies which are required? Just in that particular column, the tick mark is there. Whichever is not relevant, no tick mark is there. Are you with me till now? Okay. Now going ahead. Now another important thing is let me go back for 1 second. Now you please tell me, to achieve and accomplish this EPA, is it possible for a student to achieve this, to learn this in 1 month? No. The duration of course is 3 years, part 1, part 2, right or wrong? Right? So, this is not a one-day process, it is a continuous process starting from the commencement of PG course till the completion of the PG course. So, for the entire duration of the course, we assume that there are 6 semesters of 6 months each. Here, so for each semester, each part has been assigned. Like for learning entire this thing, something he will learn in semester 1, something in semester 2, something in semester 3. And the internship part in pharmaceutical industry for 1 month, that is when after completing part 1 examination. So part 1 examination is held when 18 months, during 18th month, after 1.5 years of admission. So during 18 months, that means completion of 3 semesters. Are you with me? First semester, second semester, third semester, total 18 months gone. Part 1 exam conducted. Now the student has entered in 4th semester, and during 4th semester he is required to go to industry for attending 1 month internship. So the EPA which requires, please understand this very clearly, the EPA which requires practical training in the industry, that will come in only semester number. Am I clear? So like this for each EPA, there is semester wise distribution. The next point. Understood? Now, you see, semester wise EPA levels and competencies applicable to each EPA. So, again, there are 2 things in this. Number 1, semester wise, that I will explain to you. During 1st semester to 6th semester, what is required to learn for one particular EPA. Another thing is, what is written here? EPA levels. As explained by respected Dr. Puneet sir, there are different EPA levels. 1 to 5. He has explained. Do you remember or not? Or shall I go ahead? Do you remember or shall I repeat? Just read this, all these 5 points. EPA level 1. If you don't read this slide, the next slide you will not be able to understand. I'm telling you very honestly. Please read this. What are different EPA levels? Level 1 to level 5. Then you will understand the next level about the semester wise EPA distribution. And EPA levels. Number 1, level 1 permission to act. No permission to act. Nothing to be done. Level 2 is he has to act, but with direct supervision of you. You are sitting in the laboratory, you are observing what your student is doing. That is EPA level 2. Number 3, permission to act. He is supposed to act. You have given him the assignment, but you are not sitting beside him. You are sitting in your own HOD room. The student is performing in the laboratory. That is level 3. with indirect supervision, but you know that he is sitting there and doing this job. Not present, but quickly available if needed. After 20 minutes, you can go and visit there on your own. Yes, what is going on? How much you have completed? What is remaining? Any problem? Are you with me? Level 4. And similarly, level 5 is very important because in level 5, permission to provide supervision to junior students. So, now you please tell me, semester-wise distribution. Semester-wise, right? Semester-wise EPA levels. Level 5 should come during this semester. Just apply your mind, you will understand. Yes, 6 semesters. So in the next table you will see that in many EPAs, in many EPAs, during the 6th semester column you are seeing everywhere level 5, level 5, level 5. Because with level 5 man, in the level 5, he has to train his juniors. He has to train part 1 and his scholars. Because he would come in part 2 last semester. So he will be training his juniors. Next. Now you can see I am not speaking anything. I am giving rest to my throat for 1 minute. Just read this and then ask me a question. I will be happy if you ask me a question. There are not many slides. Very selected. Like for this purpose, for illustration purpose, I have made this one slide only. Because this is only EPA number 1. Like this, on the next page, there are other EPAs. You can see in the curriculum graph, total 19 EPAs. So just to explain you, I have kept only one slide so that I can explain to you and you can ask me questions in case of any doubt. Please read it. Serial number 1, first EPA. Now, this is our title of the specialty course. Part 1, this is part 2. In part 1, there are how many semesters? Semester 1, semester 2, semester 3. We have modules. Semester or module. And in part 2 also semester 4, semester 5, semester 6. Now to be a drug analyst, a student in part 1 during semester 1, EPA level 1. What is EPA level 1? He no permission to it. He has to only study. He is not allowed to perform. Okay? So, what you are seeing here, EPA level 1. And now this entire EPA is split into different parts, different sections. Because this is not a task which a student can complete in 1 day or 1 month. This is to be carried out for the entire duration of 3 years, but in divided forms. As I said, something he will do in semester 1, something he will do in semester 4, semester 5, like this. So this table is showing. Am I clear? Can I go ahead? Yeah. Then in the last semester 5 and 6, guiding the juniors. What he has learned during first 4 semesters, he is expecting the same to part 1 students. Next. Now coming to the main content of the course. Main content of the course is very easy. I am just going to read. Please focus on your curriculum draft. Those who do not have draft, focus on this. we have reached up to point number 5. You see, this is point number 5. So now, in entry home part 1, there are how many papers? 3 papers. And on the first paper is FHP, Fundamentals of Homeopathic Pharmacy. In this first paper, there are many chapters or competencies. You see here, how many topics are there in this paper 1? You quickly recollect and remember what I am highlighting. Then you will be a true friend of this curriculum draft. Okay? It will be a double way friendship between draft and the faculty. Then only it will be a successful one. So, in entry home part 1, 3 papers are there. In paper 1, which is known as Fundamentals of Homeopathic Pharmacy, how many topics are there? 6. The names of topics in front of you. Under each topic, there will be some subtopics. Under subtopic, there will be only one subtopic, or there will be more than 2 or 3 subtopics. Are you oriented with me? Okay? I'm going ahead quickly. So there are many things. These are the 6 topics for paper 1, part 1. I am talking about repeatedly about part 1, paper 1. In paper 1, we have 6 topics. Now coming to next slide. Be with me please. Now, for the convenience, I will quickly come to paper 2. Before reading it, I am again recalling entry of part 1, paper 1, how many topics? 6. In paper 2, how many topics? 5. We are not talking about subtopics. Paper 1, 6. Paper 2, 5. Read the topmost line. Part 1, paper 2. 6 topics. Sorry, 5. First 6, then 5. Now coming to entry part 2. How many papers? Paper 1 and paper 2. In paper 1, how many topics? 4. When mind it, the serial numbers of the topics are continued. Under entry home part 1, paper 1, 6 topics. Then in paper 2, 5 topics. Numbered as 7 to 11. Then in paper 2. Then in part 2, paper 1. And this is paper 2. Here, there are numbers with us. If you draft also, you can turn the pages. I think now this is clear. This serial number for homeopathic pharmacy now. This paper 2 is fundamentals of clinical medicine in homeopathic pharmacy. Paper 2, part 1, paper 2 is fundamentals of clinical medicine in homeopathic pharmacy. उसका its serial number is different, 1 to 5. But for homeopathic pharmacy part, the serial numbers are continuous. Right? Here, focus on my finger one minute. Focus on my finger where I am writing. Part 1, paper 1, 6 topics. Part 2, paper 1, 4 topics, numbered 7 to 10. Part 2, paper 2, 7 topics, numbered 11 to 17. So total homeopathy 17 topics are there. Right? Now coming to part 1, paper 2, 5 topics, numbered from 1 to 5. This is your fundamentals of homeopathic pharmacy. This is your homeopathic pharmacy paper 1, homeopathic pharmacy paper 2. So this is fundamentals of clinical medicine in homeopathic pharmacy. I hope I am clear now. So to make you understand about this topic wise revision of the content of the syllabus, yeah, please. That is part 1, paper 2. Take the regular draft next. That is what I said. I am not a teacher, I am not teaching you anything. You already know everything. I just, our purpose is to make you aware about the curriculum draft for its better implementation. Are you able to locate in the draft where is part 1, paper 2? Those who have got it, please speak the page number so that others can also find it. But page numbers are different now. Some persons are having this landscape copy, this portrait copy is the final one. This is the final one. Yeah. Please understand, this copy is not the final. This one is not final. The final copy is what is there in his hand. The final copy is what has been uploaded by the NCH on the NCH website. That is the final copy. Please don't get confused. The final copy is not that which was circulated by NCH to the stakeholders for suggestions. It is also not the final one. This is the final copy having 73 pages. This is the final copy having 73 pages. You go to portal of NCH, it is uploaded on the portal, you download it directly from there so that there is no confusion. Why? Because this draft has undergone several changes. Sir knows this. Several changes. And during the last 2 months, it has undergone many changes. So this is the final copy, not that one. Okay? Because after resizing from landscape to portrait, then also many changes were made in this, not in that. That is why I am saying that is not right. Please take this drawing. So now please focus, pay attention because we have to understand the assessment part also. I am telling you about an incident. Since the regulations are new, the syllabus is new. Number 1 students, then faculties. Please listen, please pay attention. I am sharing very important part. since the regulations are new, the curriculum is also new. So the students, faculty, examiner and university, it is new for everyone. So it is our primary our responsibility to understand the soul of it. Then only we will be able to teach our students, and then only we will be able to tell our higher authorities, to your principals, to your examination controller of your university, to the dean of your university. Because in some colleges I have seen that for first BHMS, CBDC, new curriculum, batch 2022, the controller of examination has declared officially issued the panel of examiners by appointing only one examiner in the but as per rule, 2 external examiners are required. So you have to talk about. But you are not aware about the new assessment scheme. So under this draft, the assessment part is also there. If we don't understand it, then there will be confusion. So let's move on. So I think there is no need, excuse me, I think there is no need for me to read all these topics in details because you know it, perhaps more than me you know it. But I am the principal of my college, so more than me, if for teaching purpose in a classroom in front of a student, if somebody is there, you are there. Okay, so I am not going into the depth of it, but please understand these 4 lines very clearly, so that there is no confusion. Part 1, paper 1, paper 2, paper 3, part 2, paper 1, paper 2. How many topics in each paper? This table is take this picture, otherwise everything is there in your draft. And from here you have to take the final draft. I have already told you. Okay, next. Now I would like to highlight some points about this paper 2. MD Home Part 1, paper 2. Think about it. It is something which is different from the previous. It is something new for you. Please be careful. Otherwise, all these topics, you see, these 6 topics, these 4 topics, these 7 topics, these are all known to you. All the points. You will read the content here in the curriculum draft and you will be able to judge from which book I need to teach and you will be able to teach your students. But this is something which is new, which is a new concept. Fundamentals of clinical medicine in homeopathic pharmacy. Now this is the official correlation between. So now pharmacy is no more non-clinical subject. This paper is highlighting how it is related to clinical medicine, which Dr. Vipin Jain sir has highlighted in his presentation. Did you see his presentation? So under this, as I have told you, there are 5 topics. You see, these 5 topics. Introduction to the practice of evidence-based medicine. Developing a basic clinical approach. Just focus on the words of the topic. How we have tried to correlate the clinical medicine, the practice of medicine with homeopathic pharmacy. Developing a basic clinical approach through clinical cases or presentation along with different aspects of homeopathic pharmacy. Now when you will see the subtopics of point number 2, when you will see, I again repeat, when you will see the subtopics of point number 2, topic number 2, 3. Understanding with me? Part 1, paper 2, topic 3. Which is the topic? Cardinal symptoms of disease through their pathophysiology. With many classification of symptoms and miasmatic classification to clinical cases and bedside its application to homeopathic pharmacy. Like this, topic number 4 and 5 are further interesting. Please read them. Topic number 4 and 5 are very interesting. Now you must be thinking, I am happy that I have been able to ignite your mind on these new concepts. Now you must be thinking that these are the topics, okay, or the competencies. But what is to be taught under this topic? From which book? Which chapter? Which question? I am going to highlight them also. But keep in mind this topic, basic concepts of nutritional diseases and miasmatic assessment. Now think about rickets. Rickets is a nutritional disorder caused by deficiency of vitamin D. Now read point number 4. Basic concepts of nutrition. And the student has to read about vitamin D first. Nutritional diseases, deficiency of vitamin D, rickets, vitamin C, scurvy, vitamin A, night blindness, and many others which all you know. So, nutritional diseases and miasmatical assessment of that particular child, and then through homeopathic orientation and posology of homeopathic pharmacy, all are correlated, which will be coming under this topic. In further subsequent slides you will be able to understand more precisely. Next, interpretation of lab and radiological investigations. Write a short note on liver function tests, LFT. Now what it is? You will see this is function of this is the question of physiology or the question of medical medicine. Write a short note, 5 marks. But no, this can be a question of MD Home Part 1, Paper 2. Here under this topic, topic number 5 of Paper 2, Part 1, Paper 2, topic number 5. Short note on liver function test. How? Interpretation of laboratory and radiological investigation. So that is why, what is the name of this? I am taking you back to the name of the paper. What is the name of the paper? Now you are here. This is fundamentals of clinical medicine in relation to Part 2, Paper 1, the serial numbers are continued 7 to 10. Okay? Now, these are subtopics, as I said. I am not repeating them, I am not reading out. Subtopics, like MD Home Part 2, Paper 1, Homeopathic Pharmacy Paper 1. Total topics 4, serial number 7 to 10. Topic number 7 is prescription writing and dispensing. Under this, there are 2 topics, 2 subtopics. So, like under topic 10, there are 2 subtopics. So, you can read in the class. Part 2, Paper 2. How many topics? 7. Serial number 11 to 17. दोस्ती हो गया? familiar to you. And in case of any difficulty, feel free to write to us. You can write to me also, you can write to Princess also. I will share my email ID also. I will be happy to clarify your doubts further. Because our purpose is not just to make a document, but its effective implementation is the final purpose. Part 2, paper 2, different topics. Now coming to practicals. I am very much grateful to Dr. Rajamanikam sir for practical parts which topics were suggested by him. Now in your curriculum draft you can see part 1, paper 1, practicals, a separate list is there. Part 1, paper 1, a separate list is there. The same list is here. Total 10 practicals are there. I am not going to read them. You already know better than me. 10 practicals. How they are to be performed. How they are to be carried out. You know them better than me. I am going ahead. Next, 20. Total 20 practicals are there. Where in NP Home Part 1, total 20 practicals are there. Now, NP Home Part 2, only 10 practicals are there. 10. It is already in the curriculum draft. No need to take a photograph, no need to write down anything, it is already in your hand. I am just trying to establish a connection between the curriculum and the faculty. Next. Now this is very important. Please understand this. Because if you understand, you will be able to communicate to your principal, to the controller of examination in your own college as well as in your own university. What? That from the year 2024, this new PG regulation has been published in the Gazette of India by the NCH. Under those new PG regulations, this assessment part is already given. Please understand very clearly, the assessment part has been mentioned in this curriculum draft. In the curriculum draft, it has been taken from where? From where? From PG regulations only. Now I do understand what I am saying. New PG degree course regulations have been officially published in the Gazette of India by Homoeopathic Education Board NCH. Right? As per those new PG regulations, the new assessment scheme has been finalized. I am going to show to you in the slide the same thing. In your curriculum draft, which is in your hand, the same assessment scheme is written. Means at all these three places, same assessment scheme. Originally it is taken from regulations. Please. Okay. So, are you with me? From where the assessment part has been taken? From PG regulations. PG regulations are also uploaded on NCH portal. So, the same thing I am just trying to explain to you. This is nothing new. We have already there in the PG regulations, which are enforced and effective from this year, 2024 admission batch. Okay, their studies are to be done as per this new curriculum, and their examinations are to be done as per this new assessment scheme or the new PG regulations. Am I clear up to this level? Yeah. Read this. If you say okay, I will move to the next, because I don't need to explain this to you. Okay? How many term tests in part 1? Two term tests, TT1 and TT2. TT1 and TT2. First TT, 6 months. 6 months after taking admission. And after 6 months, second term test. And after 6 months, final exam. Or MDO part 1, university exam. This is known as term test are known as formative assessment or internal assessment. And summative assessment is your university examination. So total MD courses for 3 years, total term test. Now this is the part 1. How many papers? 3 papers. Read the name of the paper, you know them. Now these dates are not new to you. Theory exam, 100 marks, 100 marks, 100 marks. Passing marks, 50, 50, 50. Practical or clinical, same thing. And viva is another. Total is 200. What is the bifurcation of 200? 100 marks practical and 100 marks viva. Practical or clinical. So here there is no clinical, here there is only practical. So practical 100 marks and viva 100 marks. Total 200. Passing marks 100. Now what is the breakup of this 200? 160 plus 40. You see, summative assessment is your university exam. Summative assessment is your university exam. And formative assessment is your term test. So in part 1, total term test 2. TT1 and TT2. 40 marks each. So total marks of 200 80. So out of 80, 14 passing marks is okay. Now you need the text in the bracket. Summative assessment 160 marks. What is the meaning of this? Summative assessment 160 marks, internal assessment, yes, 160 marks university, internal is 40. So there are 2 term tests, 40, 40, but we have taken average of both the term tests, average. That is why it is internal assessment or formatting only 40, but summative university 80 plus 80, 160. And passing marks just half. 50% in the passing marks. But here there is a need to highlight that papers are 3, but there is only a common practical exam. Can you see this? There is only common practical exam. This practical exam is not for paper 1 separately or paper 2 separately or paper 3 separately. Am I clear? There is a common practical exam. See the next slide, you will understand this. Madam, you have seen in the bracket you read a common practical exam for paper 1 and paper 2. That means for fundamentals of operative pharmacy, fundamentals of clinical medicine, operative pharmacy. For both the papers, practical exam is only 1 of 200 marks, out of which 100 viva, 100 practical. Now read the second line. 20% weightage shall be internal assessment, which shall be calculated for practical background. Weightage shall be for summative assessment, right? For 100 practicals. So 100 practicals, 20 for internal, 80 for university. Next is very important slide. Distribution of topics, theory-based assessment. In MD Home Part 1, total question paper will be 3. In first paper, how many questions will come in the exam? 13. Total question paper in total paper for exam in Part 1 is 3. Paper 1, paper 3. So for paper 1, question paper, how many questions will be there? 13. See, one application based question, 4 LAQ and 8 SAQ. 8 plus 4 plus 1, 13. And one question, 20 marks, total 20. 4 questions, 10 marks each, 40 marks. 8 questions, 5 marks each, 40 marks. Total 100 marks, theory. We are talking about theory. Am I clear? 3 hours. Am I clear? Going to the next slide. Total questions in each paper. Read this line. Part 1, paper 1 and paper 2 each. In both the papers, total 13 questions, 100 marks. And these are the type of questions. Next. Now, further elaboration. One application based question will be there. 4 LAQs will be there. 8 SAQs will be there. But these application based questions, SAQs and LAQs will be coming from where? We have to select. You are the question paper setters. The university will send you the syllabus to make a question paper. Then this is the guideline for you all. How? One application based question. So here we have the options. Total. I don't think I need to explain it. You can understand it through your own wisdom. So from which topic you are required to select the LAQ? From which topic? This paper is showing to you. You see, 4 LAQs you have to select. See the highlighter. LAQ number 1, 2, 3, 4. This first LAQ from Fundamentals of Homeopathic Pharmacy, topic 1 or topic 2. From any topic you can choose. Next. Part 1, paper 2. That was our FHP, Fundamentals of Homeopathic Pharmacy. Here I have prepared only selected slides for your elaboration. Okay, this is for part 1, paper 2. From which topic? From which topic the questions are required to be selected? Okay, this is FCMHP. FCM, Fundamentals of Clinical Medicine in Homeopathic Pharmacy. Okay. How many topics are there in this paper? 5. So out of these 5 topics, from where the question is to be taken? Number 3. Next. Assessment blueprint. Now that was about the theory part. Now we have come to the practical part. Part 1, paper 1 and paper 2. We are not talking about paper 3. Why? Because paper 3 is research methodology and management. And for part 1 and part 2 there is a common practical exam. You know it? So there is a common practical exam. But what is the breakup of that exam? You see, how many marks practical? 100. And how many marks viva? 100. Theory, 100 marks. 200 for practical and viva. 100 for practical, 100 for viva. So for 100 practical, this tell your student to perform. And on what basis you will be assessing him, his competency? On this basis, internal assessment, 20 marks, because we have already talked about 20% weightage. Okay? For internal or formative assessment, then spotting 20 marks, experiment 20, logbook 20, micro teaching 10. Okay? So I am quickly moving ahead because of the scarcity of time. But I am confident you have understood the soul of this draft now. Even if there are some doubts, after reading it, you will be able to clarify by yourself also. Next is Viva part 1. Now another part after practical, Viva 100 marks. That is the bifurcation of Viva. Internal assessment. You see here discussion of synopsis and Viva 100 marks. This would be total 40 marks. Na? Internal assessment for this practical Viva only. Not for theory. Is it last slide? Yeah. I'm taking you to the previous one. Another previous one. To verify this out. I think the doubt is clear now. The internal assessment is not for theory part. My dear students, it is for practical requirement. So that one internal assessment of 40 marks, it comprises of 20 practical and 20 Viva. Clear? Similarly for second term test. Clear the doubt immediately, otherwise you will remain under doubt for life. This is the best part of teaching and learning. This we have done, no doubts. I will be very happy if you raise the hand and ask me several questions. You should make me realize that I am something which is I am not aware about it or not oriented about it. So then I will be happy. Okay. This is assessment part 2. Same thing again, 2 term test in part 1, 2 in part 2. Term 2, 40 each, my dear friend. Term test only for practical and Viva. No, I am taking you back to the same slide, my dear friend. Don't worry. Don't take the doubts at your home. Read this line loudly, for yourself, not for me. One internal assessment, that is Chander test 1. How many marks? 40. What is the division of 40? 20 practical, 20 theory. Clear? Discussion of synopsis will come in part 1 and discussion of presentation will come in part 2. Clear? Assessment, same thing, the same thing. Same thing is here, which we have discussed about part 1. Same table, only the heading has been changed, part 2. And here the 2 papers. There 3 papers were there. Here 2 papers. Paper 1, paper 3. But again, there is a common practical exam for paper 1 and paper 2. Just like part 1. Getting it? Just like part 1, here also for paper 1 and paper 2. A common practical exam of 200 marks. 100 practical. chapter 105. So it is what I was saying in the beginning. Only apparently it is looking very easy. Okay, next. Same thing. Nothing new. Same division. Again 30 questions in each paper. Homeopathic pharmacy. Paper 1, 30 questions. Paper 2, 30 questions. Now, how many in part 2, paper 1, 4 topics. But serial numbers 7 to 10. You see, 7 to 10. Just correlate. Are you able to understand? Next, part 2, paper 2. You see here. Part 2, paper 2, 7 topics, 11 to 17. You see here, 11 to 17. Are you with me? Same thing, 100 marks revision, nothing new. Viva revision, same as in part 1. Now the important thing, last, which you must know. Here is, you can take a photo of this if you want, because it is something which is there now, not there in your curriculum draft, not in regulations, but we have been told that we have been directed by CH to suggest you what should be a daily routine for a weekly training for a weekly scholar. Daily schedules. Like this, as per your own system, as per your own rules, you can modify it, you can design it for your own. It is just a suggestion, you can modify it. Times also you can change it. Next, take a picture of it this also. What the PG training you can do in the morning, what in the evening. This is just a suggestion. Annual schedule, like part 1 of 18 months. So from the commencement of the session till 18th month, you can divide the schedule like this in your own knowledge as per your own system. These are the just a minute. I'm making you draw figure. Now look at this. You should take picture of this. This slide will help you for teaching as a teacher also, and for making a question paper as a paper setter also. Like MD Home Part 1, Paper 1, FHP. Under FHP, this topic, Philosophy and Development of Homeopathic Pharmacy. So based on this topic, SAQ, this is the example of the SAQ. And this is the example of AAQ. So on a particular topic, in which way you can frame a question. Whether it is SAQ or AAQ, just an illustration to make you understand about it. This is nothing new, we know it already. But in a structured manner. Okay? Sorry? SLOs. Yes, I will cover the slide. Similarly for part 2, paper 1, topic wise, what type of SAQ or what type of AAQ you can form, just suggestions. Maybe in a better way, you can only get the questions. These suggestions are there. To make your job simple. Application based. These are the examples of application based questions. This is just an example for one topic. You can make 10 questions in the same way from that topic only. Part 1, paper 2. Yes, the example of LFT and wickets which I was giving to you. Harriet function test. Same topic is there. You see HON, BG, FCM, HB 05. 05 means this last topic. 5 were there. Last topic was about nutrition and nutritional deficiency. Same. Doubts and concerns? When we are thinking about the learning objectives or the learning methods, then in this curriculum draft also in the initial pages you will see Bloom's taxonomy, Bloom's Miller's pyramid about the learning methods, different levels of which we have discussed, goes how, shows how it does. Similarly, here as per Bloom's taxonomy, who was Bloom? Benjamin Bloom in 1956, 54, 56. He formulated, actually one committee was constituted and he was the head of the committee, and he formulated a method for analyzing and for studying, classifying learning objectives. So as per that, these are 5 stages. R is remember. U is understand. A is You remember it. That is one. You not only remember it, you also understand it. That is your second level. Third is you not only understand it, you are able to apply it. You are able to execute. You are able to perform. That is your competency. That is your application. Next is analyze. Then one thing was left, sorry. Evaluate, and lastly create. Okay. So these are different levels or objectives, learning objectives to attain. Now taking back to the first slide, PPS. To learn and to achieve the task, to make ourselves able, competent enough to perform a task. We should be able to remember, understand, apply,